Welcome to Health Center. My name is Anika Daniels-Osaze, and I am the Director of the Office of Diversity, Education, and Research. At SUNY Downstate Medical Center this month, we celebrated Hispanic Heritage Month in conjunction with the Arthur Ashe Institute for Urban Health and the Brooklyn Center for Health Disparities. In this series of what we call Café con Leche, we brought in a keynote speaker named Manuel Rosa. Manuel Rosa is the Director of Community Relations at the New York State Governor's Office in the Department of Faith-Based Community Development Services. He is also the former Assistant Vice President of the New York City Health and Hospitals Corporation. This program was actually a vision of the new Associate Dean of the Office of Diversity, Education, and Research, Dr. Carla Boutain Foster. Let me just give you an idea of who our keynote speaker was for this event. Mr. Manuel Rosa, known as Manny to his friends, has enjoyed a career of public service that spans more than 39 years, including his current position as Director of Community Relations for the Governor's Office of Faith-Based Community Development Services. He also serves as an adjunct professor in the Urban Studies Department at Queens College at the City University of New York. Manny has been employed in various capacities in the government, including the largest public hospital system in the United States, known as the New York City Health and Hospitals. He has served under 3 governors of the state of New York, was appointed as the first director of the New York State Office of Minority Health, and as the assistant to the Congresswoman Nydia Velasquez as the first district administrator. Manuel has also worked in both chambers of the New York State Legislature, the New York State Assembly, and the New York State Senate. He's worked in the office of the Bronx Borough President, the office of the President of the City Council of New York, now known as the Public Advocate's Office, and as Executive Director of the nonprofit Health and Social Services Office in the South Bronx. His community activism has led him to serve on the advisory boards of the National Latino Behavioral Health Association and the Puerto Rican Family Institute, the Queens Hispanic Heritage Committee, and is a founding board member of the Association of Hispanic Healthcare Executives and as a vice president on the board of directors of the Latino Leadership Institute. A native of the Bronx, Manuel is married to Iris Rodriguez Rosa, currently the Bronx Borough Commissioner of the New York City Parks Department, and is a proud father of his daughters Rosa, Sylvia, and Jasmine, and a grandpa to his grandchildren Noel, Sophia, Annabelle, and Raphael. We were so pleased to have him speak today on our theme, Embracing Latino Culture in Order to Improve Latino Health.
I know that we're in the middle of an election year and people talk about the Latino political vote. It's only as good as our participation. So for anyone, this is just an unsolicited thing, for anyone who is registered to vote, this is what I tell my class. You have the power to vote. It is your American Express card. How you choose to use it is up to you, but use it, because you won't have another chance for another 4 years, at least for president. So it's really, really important. And so, you know, we are celebrating Hispanic Heritage Month, and I always remember the celebrations that we've had with under the governor, and you know, the large celebration of feeling proud of who we are and the accomplishments. But the flip side of that very same coin is the day-to-day existence of our community. We heard some statistics about size, right? But most of you are students, I guess. Or you work here, whatever the case may be, you are serving a community and you're serving a city that is dynamically changing. When I started out in government, the largest, and still is to a certain degree, the largest portion of the Latino population was Puerto Rican. But we now know that that's changing to Dominican and South American. And if you live in Queens, for example, you see the strength of the South American community, Ecuadorians, Colombians, Venezuelans, Dominicans, right? And the Dominican power. We are happy that Adriano Espaillat, for example, is now going to go to the House of Representatives as the first Dominican ever to represent his community in the United States Congress. So that's an accomplishment, right? And we keep on growing, and we should be proud of that, whether you are Dominican or not, because it speaks to who we are as a people. But there are challenges. There are challenges, and I don't want to bore you with too many statistics, but I want you to think about this. We are not monolithic, and that's the one thing that I would say to any student is that the critical thinking about how we explain who we are is to understand that, yes, we may have the moniker of Latino, Hispanic, but in reality, we identify ourselves with our culture, whatever that may be. And so, you know, we say we're Puerto Rican, or we'll say we're Dominican, or we'll say we're Colombian, with pride. And I will say this, that over the years, historically, Latinos have maintained their ability to maintain their culture and their heritage. We just happen to be sharing it with a majority population. But, you know, at some point along the way in this travels, a grocery store became a bodega, and everybody understands grocery stores to be bodegas, as an example. Okay? And we know that salsa is more than what you put on food, right? It's a little dance, right? And so we see the integration of our heritage into the broader culture. But those of us who have a responsibility to teach and to serve must understand the challenges that lie before us. And we do so by speaking to truth, so that if we look at our populations, we understand that it's an uneven situation. There's a time where I worked under Mario Cuomo, and we had to do a briefing for him. I was deputy director for Hispanic affairs under the governor. And I had to do a briefing based on an article that was written that he became curious about the growth of the Hispanic community. Now, this was in the 1980s. I had hair, by the way, one time, just to let you know. Okay? And in the 1980s, we wanted to look at what was the difference between the Cuban population, the Puerto Rican population, the Mexican population. And it was more than just where we came from, it was also economics. And I noticed a sign out there talking about cultural competency. And cultural competency means that we understand the differences in our cultures as well, in terms of our economics, in terms of the way we see things, politically and otherwise. Right? I also want to introduce another concept that I've been talking about for a long time, which is community competency. And community competency is where you serve in knowing the institutions and the strengths and the weaknesses of those neighborhoods and communities that you are going to be serving, whether here at SUNY Downstate, in a hospital, in a medical setting. You have to understand where your patients are coming from and what they're facing. I'm not talking about the churches. I'm talking about what are the strengths and the weaknesses of those communities, because day to day, our patients become our constituents become the people that we serve, and then we need to understand how best to serve them. And it's just more than saying, you know, and taking their temperature. We're taking their emotional temperature, their spiritual temperature. We're taking, you know, an idea of what they are facing economically, which, because of the mental health stresses, we have come to understand over the years that there is not a big difference, very frankly, between the cause and effect of stresses on mental health and physical health. And we are coming to understand under that science, very frankly, that there's a direct correlation between the two. And so when you see depression in our communities, for example, well, that depression comes from somewhere. There's a cause and effect. The social sciences call it, there's a root cause. Right? You try to get to a root cause for something. So, and if you look at screenings, cancer screenings, when I was director of minority health, I had to go out to Suffolk County. Suffolk County has a huge Latino population. Come to understand that prostate cancer for a man, for all intents and purposes, became a death sentence. Why? Because they get the screenings too late, because of lack of education. And so we had to understand that somewhere along the line, we had to go out there and speak to our communities, and we had to speak truth about, yes, it's uncomfortable because you're Puerto Rican male, and you know, you talk about prostate cancer, so no one's going to do that to me, you know. The pride, well, you know, if they don't do that to you, then your family may be suffering your loss. There's the truth. The breast cancer screenings and how we talk about that in public. That was one of the interesting things when, as director of minority health, go to the hospital system, went to Greater New York Hospital Association to talk about cultural competency. And I was talking to my class about this last week, pardon me, yeah, earlier this week, in fact. I said one of the things that we had to show the hospitals was how we as a community use the system, right? And a lot of times there's this discomfort that when someone is sick, we tend to bring our family members, right? The mother, the father, the sister, the cousin, the grandmother, the uncle, the aunt, right? And it's one person, but 10 people in the room with that one person. Why? That's our support network. Oh, you can't have that many people in the room. And we have to understand, very frankly, that that's not the way we interact with our medical systems. And that becomes important as well. Or you go into the medical room and they follow as well, right? No, you can only have one person with them, right? And then they have the rosary in their hand and they're grabbing it on, grabbing onto it, right? For dear life, again, support. No, you can't have that metal object in the room. And so we had to share with the hospital systems that this is the way we interact, and somewhere along the line there had to be adjustments made accordingly. Let alone the science of healthcare. One of the most difficult challenges for people in poverty is that we look at, right here, right in this neighborhood, you see what was with Kings County across the street and SUNY here. And when I say what was, is because the public hospital system for the longest time was the only system that would take in people that didn't have insurance or had Medicaid, and even then, back then, they didn't have Medicaid. Would refuse, other private hospitals, would refuse to take in someone that was uninsured. Right? So now we create this system of, well, we have the teaching hospital, and then we have a hospital that is going to take care of those that are insured, and if you're, we have to stabilize you in the emergency room, and then we'll transfer you across the street, or we transfer you to a public hospital. Now, watch what happens then. But then the economics of healthcare, which is something that students need to understand, says, what is the best insurer and who is the best payer? Oh, it happens to be Medicaid and Medicare in 2016. Not so much now, the divide. And if you go up to the Bronx, for example, you'll see North Central Bronx and Montefiore. And you know what connects them? A hallway, a tunnel. Because they symbolized if you had insurance and if you didn't have insurance. Not so much anymore. Now everybody's fighting for that Medicaid dollar. We have over 5 million people in New York State that are on Medicaid. We spend in New York State $63 billion on Medicaid. All funds. That's a lot of money. And so what happens is that the systems adjust to where the money is, but now we also have to find a way to adjust to the populations that we're serving. And it's not all Puerto Rican, and it's not all Dominican, and we have to understand that people are not don't have a private doctor. And for the longest time, by the way, in the South Bronx, the only doctor was the hospital, for the longest time. And I am old enough, and I'll say this, that I had a doctor come to my house when I was a little boy. If you have that now, that's in the newspaper, right? That is in the newspaper now, okay? What was back then, in terms of the delivery of healthcare, is not now. And so our people need to be educated, and you are the educators, you are the coaches, you are the people that are going to hold their hands. And we understand that our folks need a lot of hand-holding sometimes. It can't be that 15 minutes because, managed care says, well, you need to have the formula, 6 patients in the hour to get your money and things like that, the economics of healthcare. And we need to debate that, very frankly. Because I just said that we spend $63 billion. I did a presentation 2 years ago when Obamacare was just coming on board. And the question that I have for all of us in this room is, what are the outcomes that we get for our money? You see? In this room, we are both stakeholders and stockholders of the system. But we don't see it that way. If you are a stakeholder, clearly you are either going to benefit or you're going to use the system, right? And you want to make sure that there's quality health care. But as taxpayers, folks, you are stockholders. And you want an efficient system. And you want a system where the recidivism for asthma and diabetes and the emergency rooms is reduced. You see, we used to measure our health care as how big is the hospital in our community? How many rooms, right? How many people did it employ? Now we need to measure healthcare in a much different way. And I am saying to you that as our population continues to grow, and we will, by 2050, be 25% of the total population of the United States, 25%, 1/4. So 1 out of every 4 people, you look around the room, it's us. Okay? So who has a greater stake in the success of the system than we do? And we're young. We are a young population. Our birth rates are still high. And unfortunately, even our teenage pregnancy rates still have a challenge with that. But the idea that we don't have a stake into what the healthcare system is going to look like in the next 30 years would be the fallacy of all fallacies. And in this room, all right, there are people who are responsible for the delivery of healthcare, for the management of healthcare, and what the healthcare system is going to look like. You, right, in 30 years. God willing. Okay? So there is this symbiotic relationship between the population that is here today and you as leaders, administrators, doctors, providers, right? Because it's more than the doctor. It's more than the nurse, with all due respect. The healthcare system is the coder, right? That brings the money, right? That sustains the system. And somewhere along the line, we have seen what happens when a system is not sustained. We have closed hospitals and fewer doctors and fewer providers. And who's going to suffer then? If our population is going to go up, who suffers? You see? So there is this relationship, if you will, on October 7, 2016 to October 7, 2050, with all due respect, because we need to understand our responsibility now about shaping a system in which more of our people are going to be relying on. And the older we get, and we all know this, right? The older you get, you need the medical system, right? And and ours is a population that doesn't necessarily bring all our grandparents and our elderly to the senior homes, nursing homes. We keep them, right? And so when we talk about the politics of healthcare and we see what's going on in Albany and when we see what's going on in City Hall or we see what's happening in Washington, pay attention. Why? Because maybe that nursing aide that you will need in 30 years may not be around because we decided that, hey, there was a budget cut. Or we didn't have it because we decided, very frankly, that we're going to increase the standards and criteria for licensing these individuals. There are times when our community is locked out of a system because the standards change and our folks cannot get licensed. This happens in social work world all the time, especially in substance abuse. You see, we have to pay attention. That is the healthcare system as well. If we're going to marry physical health with mental health, with substance abuse services and things like that, we need to pay attention to all these levels. You need to pay attention to it. I need to pay attention to it. And we need to educate ourselves. Because in the long run, as stakeholders, you see, our ignorance will either kill us, right, or empower someone else to make decisions for us. That you cannot do. Okay? You know these medical proxies and things like that we have to sign now for someone else to make a decision? If we're incapacitated, well, our ignorance will incapacitate us and our community, right? So that other people, because we didn't vote, because we didn't participate, because we didn't do our homework, right? Other people will be making decisions for us, even if we're 25% of the population. You see? So we have a choice. And it's good that we celebrate. You know why we celebrate? Because we're proud. But we need to also understand that this is a good time for us to pause. Eric Cuomo used to say, pause in our deliberations, right? To pause and take stock of what we have, right, as a community, speak the truth. Because if it's not working, then let's hold people accountable. I don't care who it is. But I need to tell you something. I've worked for legislators that have been around forever, never, never. I think they were there when, the state was first founded, okay? So you're either part of the solution or part of the problem. And after 30 years, and we still have those problems in the community, well, we got to call it for what it is. You're a problem, man. Okay? And only you, remember that Federal Express card that I talked about, that vote? So on November 8th, right, it's not only the president, it's Congress, it's the state legislature. These are people that are going to be making our decisions. And since you're part of a state system, guess what? Who has a greater stake than you guys? And what happens in Albany? Right? I'll end with the story, and I'll tell you why it's so important that the SUNY system remain. I was up in Syracuse as Director of Minority Health. I was asked to go up there. And there was, I guess, an observation that pregnant women who were on Medicaid, especially minorities, Latinas, and African Americans, were not going back for their prenatal care. You and I know how dangerous that is, then, because if they don't go back, the low birth weight, then the possibility of having something go wrong in the pregnancy becomes a lot higher. The risk goes high. So I asked the question, well, what was happening? And this is what was happening at that time. There were medical physicians and personnel that were stigmatizing Medicaid recipients and looking down on them, you see? And we had kind of understood that that was a problem, okay? Now, why do I say this story? It's 2016. I look at this room. I know what it is not to have people that look like me and you in the room, whether it's the decision-making room, the examining room, the classroom, right? I know what it is not to, okay? I'm proud of everyone in this room. I really am. I'm glad to call you colleague. But I also want to give you the challenge that behind you there are others that you must bring along somewhere along the line. Not to pay it forward, but to bring it forward. So that when all is said and done, that 25% that I'm talking about can be somewhat assured that their interest is being protected. So I thank you for your time.
Thank you very much. Do we have any questions from the audience? One question I do have for you is, in terms of your role in the office that you serve in right now, what kind of programs are being held that actually deal with the issues that we're faced today?
Our office is the first of its kind. Governor Cuomo, when he was Secretary of HUD, Housing and Urban Development, created a faith-based office. Kind of understand, very frankly, the churches and faith organizations, all levels, play a major role in community development. The problem is that they either lack capacity or information to move forward with their services. So what we tend to do is we liaison with churches, with faith-based organizations, nonprofits, to bring information as to what they need to do in order to apply for grants, capacity building for those that want to create their nonprofits, or to give them information that, hey, this grant proposal is up and you have to get something in by such and such a date. Mm-hmm. So it's a lot of information and a lot of coordination. In New York State, like every place else, there is the separation of church and state, so that any one faith organization, we cannot give money directly to a church. Mm-hmm. It has to be a nonprofit. A lot of faith organizations toy with the idea of creating their nonprofit organization. So we try to help them in terms of putting together the board, understanding what the rules are, linking them up to the New York State Department of State's website so that they understand the rules about incorporation. And so information for them empowers them. And so our office is empowered. We do not have the money. We don't administer grants per se. But the state put out almost $1 billion in grants. So someone is getting that money, and we want to make sure that people in our community is getting the money as well.
And this money can be used for healthcare programs?
Yeah, absolutely. We get, in fact, the Department of Health. In fact, the Department of Health did a couple of things. One was on a capital grant for clinics that needed to get some help. They just put out a grant of about $500 million across the state. And in some cases, it's targeted either to diabetes or to asthma or something like that. So that the Department of Health, when they do put something out that's targeted, then we try to get that information out to them as well. There's a lot of information out there, and so the question is, how do we maneuver the internet or the information that we have to our benefit? I talk a lot to my students about doing their homework, not the assignments that I give them, but actually looking at the issues from various different ways. One of the things is, a friend of mine taught me something called the onion. And the onion is very simple. Every issue, like an onion, has different layers. And one leads to the other, till you get to the core of the matter. We have to learn how to ask questions, first of all. We have to learn to ask questions of those who represent us in government, whether they be appointed to an office or voted in. Every elected official has a district office.
Thank you.
Okay, thank you. Okay.
Please stay tuned to future events held by the Health Center here at SUNY Downstate.